Hello and welcome to Niaga Spotlight with me, Tehmina Kaoosji. Niaga Spotlight takes us through the week in economic analysis and future affairs. Now today on analysis, our spotlight falls on the 100 ringgit SARA rollout and looking at whether it could be a subsidy revolution or just a stopgap. Now, over the Merdeka weekend, the government rolled out Bantuan SARA, the 100 ringgit credited into the MyKads of 22 million Malaysians, injecting roughly 2 billion ringgit into the economy overnight. Now, in just the first 2 days, more than 1.7 million people had already spent 110 million ringgit at stores nationwide. But this surge wasn't without strain. Terminals buckled, queues grew, and the government had to boost the MyKad system's capacity by 20% just to keep up. And yet, the bigger story goes beyond glitches. For some Malaysians, 100 ringgit disappears perhaps in a cafe meal, a treat. For others, it feeds a family for a week. That relativity reminds us why design matters. Is this the start of a digital subsidy revolution that could one day potentially deliver fuel, healthcare, even microfinance? Or is it a one-off relief that exposes more flaws than fixes? This morning on Niaga Spotlight, we unpack the economics, the technology, and the human reality behind the Bantuan SARA 100 ringgit rollout. An absolute pleasure to welcome to studios now, looking at Derek Kok, Senior Research Analyst with the Cheah Institute on Southeast Asia at Sunway University, joined together with Vyshnavi Charrlotte, Program Manager with Social and Economic Research Initiative, SERI. Very good morning to the both of you. Thank you so much for making time. How are we both doing?
Great. Thank you so much for having us, Tehmina. Thank you.
Thanks so much for having us on the show.
Fantastic. So, Derek, perhaps we can get started off by setting the scene and looking at the digital rails. Of course, plenty of quite justified criticism has also come out for the hiccups that were faced with the 100 ringgit rollout. But if we, let's say, move the SARA onto open e-wallets, such as we've got Do It Now QR, we've got GrabPay, how do we then balance ease of access with the risk of leakages or even potential misuse?
Thank you for that question. Whenever we speak about welfare programs like, SARA, the question that we have to grapple with is whether do we want to prioritize reaching those who deserve it, or do we want to exclude the wrong people who don't deserve the aid? It may seem a very, unimportant distinction, but historically all over the world, we see that a lot of costs and resources are spent on making sure that the wrong people do not get access to these kind of programs. So when we talk about widening access and we talk about what do we want a functional, progressive social protection system, how does that look like? It basically, we should prioritize access to the most, if possible. And when we talk about leakages, right, you mentioned leakages, you mentioned potential barriers. There's been a lot of administrative systems that have been built, to make sure, to ensure that we reach the right people and we exclude the wrong people. We've seen how in Malaysia, for instance, the petrol subsidy scheme in 2019 cost about 25 million. So when we speak about leakages, we always assume it's related to the program itself, right? What kinds of potential abuse can arise? But we don't talk about how when the administrative system that has been built to exclude the wrong people ends up being a leakage in itself. 25 million to set up a software system just to do that, whereas that resource could have been directed directly towards the rakyat. We also need to talk about leakages from restrictive options itself. For instance, SARA, you are only allowed to purchase from 14 categories, right?
That's right, exactly. Now, I think you've made some really salient points over there, but at the same time, looking at systems that don't cost us too much, just a point of reflection, the fact that by the end of 2024, about 2.6 million Do It Now QR merchants had already gone live everywhere around Malaysia. So that might be an example of showing us that scaling is immediately possible, and you do not necessarily need to invest that much in a closed loop system. Exactly
my point, because these systems already exist. And in Malaysia, I think the use rate for e-wallet system is about 88%, which is really, really high.
Even in rural areas, not just urban hubs, 88%.
Right? And in fact, in rural areas, for instance, where, digital access is a problem, this can perform as a way to incentivize the adoption of more digital tools and again, become a blueprint for the government to use this as a welfare redistribution modality.
Absolutely, and we also have regional neighboring examples too. Singapore has its CDC vouchers, which actually show wide access can actually work, and at the same time, it has real-time fraud detection built into the system. Very interesting indeed. Vyshnavi, I'd love to go into SERI's perspective and your work with vulnerable groups. And first of all, let's lay it out for everyone watching. 100 ringgit stretches very differently depending on the socio-economic background of individuals. For, let's say, a rural family in East Malaysia versus an urban renter in KL. Let's dig deeper.
Okay, so I think when you think about how 100 ringgit stretches between the urban and rural, right, it comes down to living cost. So living costs in Malaysia vary greatly between the urban and the rural, and according to the Department of Statistics Malaysia, in 2023, the average monthly household expenditure for the urban household averages around about 5,040 ringgit, whereas when it comes to rural households, it averages around 3,631 ringgit. So when you think about it that way, for urban families in KL, 100 ringgit can help ease part of the grocery burden for the month, but it does not meaningfully reduce the overall stress of rising food costs and rising food insecurity in the urban areas. So with nearly 80% of Malaysians now living in urban areas, food security is less about availability and it comes down more about affordability. And if you take a look at rural communities, the cost of living appears lower, mainly because many households rely on locally sourced produce to put food on the table. So this doesn't necessarily mean that 100 ringgit stretches significantly further either. So access and availability remain critical challenges in the rural communities. For families in Sabah and Sarawak, if you think about it, where poverty rates remain among one of the highest in Malaysia, rural households are often more vulnerable. So poor roads, limited connectivity, especially reliance on goods shipped from Peninsular Malaysia, mean that disruption from either weather or even fuel price hikes makes food availability unstable, and it also drives up costs.
So you're adding on those logistics costs in addition to the fact that it already costs you X amount to get there.
Yes, yes. So if you think about it, if it already costs you X amount to get there, shipping these products from Peninsular Malaysia to Sabah Sarawak will also increase the price there. I remember on my visit to Sarawak once, I saw a loaf of bread costed close to 9 to 10 ringgit, and that genuinely shocked me. And that's when I realized that a lot of these goods, the prices are being hiked up to cover the transportation costs. So among that, the approved list of items under the SARA program includes staples like rice, oil, instant noodle, cleaning supplies, like what Derek mentioned, the 14 categories, right? So these are valuables but they only cover around 10% of an urban family's grocery bills. So leaving out essentials like meat, vegetables, and other raw ingredients that most Malaysian households depend on for food, if you think about it. So for rural households, the list is useful, but not always practical. So many already grow and source their own raw produce, making their living cost over there lower. But if you add in the aspect of these 14 categories, does it really help them in terms of this one-off 100 ringgit cash aid? So that's the kind of things we need to think about. And another important aspect is that 100 ringgit is universal for all Malaysians above 18 with the MyKad, right?
That's right.
So this means whether you're a single renter in KL or even if you're a rural parent supporting children, the relief is the same, but the lived impact is different. So
Very
for
true.
wealthier
and maybe how many adults also there are in a home, which in a way also did, in a sense, contribute to the overflow of individuals who were there at payment terminals over the long weekend.
Yes, and I think if you look at it, I think when you think about a household with maybe 2 children, 2 parents, 2 children above 18, that's multiple MyKads trying to be used for maybe a single grocery bill purchase. So thinking about the logistics of that as well should have been taken into consideration before day one of the rollout of the SARA program. So another thing to consider is for wealthier households, right? The amount may feel small and symbolic, but many donate their aid to others in need, which is a great thing to see, and it shows Malaysian support for solidarity. But for lower income households, it is helpful but still insufficient to address the deeper challenges of affordability.
Yeah, absolutely. And it's very interesting because our preliminary qualitative questions that have been posed to store owners such as Maiden, etc., that saw a huge volume of SARA uptake, they've already clearly stated we are seeing rice, eggs and bread, and big bags, 10 kgs of rice, you know, as well as trays and trays of eggs, and even loaves and loaves of bread being top on the list of what Malaysians are redeeming with their 100 ringgit. Derek, so to dig deeper into the categorization of this specific 100 ringgit MyKad rollout, tell us more about what are some of the risks of, in that sense, dictating what can and cannot be purchased, and perhaps looking beyond that paradigm too.
Yeah, I think ultimately individuals know your finances best, right?
Sure.
Financial needs change every month, every week, every day, right? And a lot of times those financial needs don't just revolve around basic household items, which is what these 14 categories revolve on. But the interesting thing as well, that aside from these 14 categories, you're actually not allowed to purchase fresh fruits, fresh poultry. Those are excluded. So what is the rationale behind that, right?
There's the rationale of, I think, essentials versus also all the items you named, nutrition value.
Yeah, and of course, you know, and these are products with nutrition value, which in Malaysia, we actually have issues of affordability when it comes to more nutritious items. And the interesting thing is that usually we will impose this kind of restrictions for programs to avoid the use of temptation goods, for instance, alcohol and cigarettes. Although, something to share, evidence actually shows that in many countries, you know, cash transfers and welfare aid like this don't actually increase the use and purchase of tobacco and alcohol. And in fact, if the government's rationale of having these 14 categories was to prevent the use of this or purchase of this kind of temptation goods, instead of 14 approved categories, the government could just have one restricted category, you know? And it still doesn't answer the question as to why essential items which are nutritious, such as fresh goods, are not included.
Absolutely. I think you've raised some very interesting points there, including the fact that this is actually supported by World Bank global data, which shows less than a 3% incidence of misuse when it comes to rolling out without restrictions as well. Neighboring Indonesia, they also quite recently updated their food delivery program, the program Sembako, to actually widen the scope of what items are covered. So it's clearly showing that there are regional examples, but what would it take to perhaps move away from the idea around having to dictate in a rather paternalistic manner what those who are particularly from the B40 vulnerable groups can and cannot purchase?
I mean, it's sad because the assumption when it comes to this kind of policy making is that the B40 lack financial literacy or, you know, a certain savviness when it comes to purchases, that, you know, again, it's the state paternalism that it knows best, and the poor and the B40 don't know any better. But research and data and evidence doesn't, you know, support that. In fact, we find that it is the issue of access and affordability that is the main hurdle over here. So using, for instance, like, you know, if we widen up accessibility to this, to SARA, what we can do is actually empowering, you know, individuals to make informed decisions when it comes to their financial situations. Because ultimately, like I mentioned earlier, if you are a parent with a child, your financial needs change all the time. It could be the fact that tomorrow, you know, my child is sick and I need expensive antibiotics. Next week, my motorbike breaks down and I need that for my job, you know, in an informal market.
That's right.
All that affects income as well. And when we restrict, although, you know, it's well-intentioned, when we restrict the spending of recipients, what we're actually doing is creating perverse incentives for people to try and beat the system, because the reality is that they're not getting the aid that they need. Just to quote an example, a few years ago, we had the book voucher program that was given out to students. I'm not sure if any of you remember that.
That's right, yes.
What we saw was that people were actually taking those book vouchers to bookstores and trying to sell them for a lower value. Now, that's an example of a leakage in government spending, because let's say if the government gives you 200 ringgit, you only get 100 ringgit, because the other 100 ringgit goes to the shop that you sold those vouchers to. Why does this happen? It's because the aid that you're getting is, the need that you have is not being met.
It's a mismatch, clearly, in design.
Yeah.
So I think where we perhaps what needs to be done at this point in time, because we also have till the 31st of December for the rollout to be complete in this cycle, we can actually put in place mechanisms that hopefully help to address this, right? Now, Vyshnavi, then going deeper into looking at trust under strain when such systems are rolled out, right? So when people are queuing, transactions are failing, of course, it does damage a certain amount of confidence in government aid. So how can this be constructively addressed now that, of course, it has clearly come out as a potential issue?
Thank you, Tehmina. So if you think about it, right, one of the SARA's program's greatest strength is its simple redemption system via the MyKad. So this ease of access makes it user-friendly for millions of Malaysians. But as SERI has highlighted in our recent statement, when systems encourage glitches and experience of receiving aid matters just as much as the aid itself. So how people get that aid and how they get to redeem that aid matters so much more than receiving that aid itself, because that is what increases people's trust in the government, right? So if system fails and the queues are long and people have to pay in cash when their credit doesn't come through, these are things that reinforce the trust that, the distrust that we have in the government. So on 31st of August, we saw how transaction failures and long queues created real frustration. A lot of recipients faced both practical and psychological harm because of this. So some even paid cash despite having the SARA credit.
That's right.
So these incidents can shake public trust. When promised aid does not drive smoothly and households start doubting whether systems are reliable, this brings up a whole different myriad of problems. So even if the problem is temporary, the memory of failure, it lingers. So confidence is especially fragile for vulnerable groups, if you think about it. If some succeed in redeeming the cash aid, but others are turned away due to technical errors, it creates a source of unfairness, and it also breeds resentment. So elderly people, the rural, the poor, even undocumented individuals, when it may even stop trying, believing that the system is stacked up against them. So the broader implication is that the SARA program and similar programs are highly visible symbols of government care. But if the system fails, it doesn't just damage the program, it risks undermining faith in the Malaysians' transition to a digital public service more generally. So in order to prevent this, some recommendations and some practical measures that we have included is basically staggered go live. So making sure that when cash aids are dispersed, we have a staggered release so that there's no overload in the system. So I think with the SARA program, when close to millions of Malaysians were going and redeeming everything on 31st of August, systems shut down, people were frustrated. So
I mean, it's a very symbolic day, but it's also a national public holiday.
Yes, exactly. So we need to think about the feasibility of that. So thinking about how we can stagger the rollouts. Another thing that we can do is also real-time status dashboards. So making sure that the system is monitored, whatever complaints that come in, appeals that come in are addressed live, and so that people can see transparency that the government is collaborating with them to fix these issues. So to build more trust within the people and the government. And then also another thing is, for example, when people had to use their own cash when the credits didn't approved, making sure there's some kind of fallback. So either secure e-vouchers or even some sort of claim later reimbursements for families who've had to use cash but later on can claim back from their SARA credit. So these are all things that we need to think about when rolling out such a big program, especially on such a symbolic day. So the key message here is relief must be reliable. Malaysians have shown that they are ready for digital social protection, and the task now is ensuring that every single transaction bills rather than erodes confidence in the government.
Absolutely, and I think you raised a couple of key areas there for reflection and also improvement. In particular, of course, tempers ran high because some families had to actually pay a little more than what was anticipated because they were not able to redeem the 100 ringgit per individual. So that points to the fact that perhaps you need to have those immediate vouchers on standby for, let's say, a certain proportion, maybe 20% of transactions. Instead of, yes, it was admirable how the MyKad system was able to be boosted in capacity by 20% quite immediately, but the moment peak hour came the next day, on the 1st of September, once again, the surges caused systems to crash. Yeah. Anything that you're observing overall from these areas?
I mean, the other thing is that it's not only the fact that some families had to pay cash, but many families had to abandon their trolleys at these places and walk away. Now, of course, social media says that it's because, they couldn't get a bargain, but at the end of the day, these aren't luxury items. These are absolutely essential items like eggs, rice, and bread, and families are literally walking away, from the cash point because they don't have the 100 ringgit that they were supposed to be able to use. And I think it shows us how dire the situation is when it comes to, cost of living, although many are saying, oh yes, this is just, an attempt of Malaysian citizens trying to get a good bargain.
Yes, but again, look at the actual content of the baskets.
They are not luxury items. They're absolute essentials.
Thank you. Thanks, Derek. Thanks, Vyshnavi. We do take a short break and we'll be right back after to continue the discussion. Don't go anywhere. Welcome back to Niaga Spotlight, still with me, Tehmina Kaoosji. And today we're discussing the 100 ringgit SARA rollout and whether we're looking at more of a subsidy revolution or perhaps a stopgap measure. Derek, continuing with the conversation and looking in particular at income thresholds. Now, many Malaysians, of course, they earn uneven wages. So in the case of such a rollout and also future potential rollouts, how do we actually look at families who may then risk being cut off once they move up perhaps even just a few tens of ringgits into a different income category, but then that does not really decrease their vulnerability overall?
Yeah, thanks, Tehmina. I think what you just described there is a textbook case in social policy. We call it the cliff effect. And literally what happens is that, when the income increases even a little, the cliff effect is such that they may even lose more in terms of the subsidies and aid that they get, simply because the income went up just a little. And this is an inevitable and direct result of targeting mechanisms. So when you deliver aid strictly based on income and poverty targeting mechanisms, this is a direct effect. So how do we move forward here, right? And how do we avoid that happening? The answer is basically moving towards progressive universalization. That was quite a mouthful. And really, we see that actually in SARA. So although, critics have been pointing out that the 100 ringgit may not be enough, but what I see SARA as is that it's a potential game changer, because in Malaysia and actually in the social policy world, a lot of focus is on poverty targeting. Let's look at the B40. But the reality here is that in Malaysia, the vulnerability of many working individuals in Malaysia is such that they are just one sudden financial shock or emergency away. So instead of the B40, we're looking at data that perhaps shows us that it's not B40, but B80, simply by how vulnerable large segments of the population is, which tells us that a large segment of the population require aid and help from the government. So how do we move forward, right? And I mentioned SARA because it is the first time that something has been given universally without looking at income. And that is a potential window for us to basically normalize and sensitize the idea of more universal welfare programs. Of course, that requires costs, that requires money, a lot of resources. But how do we do it? We need to move towards income or poverty targeting, towards a life cycle approach, which looks at specific vulnerabilities at each life cycle of a person. And some of the specific vulnerabilities are, for instance, at childhood. One of my policy recommendations for many years now has been to push for a universal child grant, because that is an incredibly sensitive period, but also it is actually the lowest and cheapest investment with the highest ROI.
Exactly, because that's where you actually are able to intervene on a national policy level if you want to be able to address childhood stunting, malnutrition, and the entire dimension of adulthood issues that comes along with. It's also very interesting to note that of our e-invoicing rollout will be able to reflect real-time income, but cliff edges, once again, they risk hurting families when they move perhaps just even a couple of ringgit amongst income classes. So there's much to be pondered over here, and also the action does need to be taken, perhaps modeling from OECD countries where they actually have a grace period for cutoffs from targeted subsidies so that there is enough time to actually measure qualitatively and quantitatively whether or not a family ought to be definitively moved into a different income class. Yeah, lots to say over there. But Vyshnavi, going into looking a little broader and casting the net with an eye towards what will be rolling out later this month in September, we've also got the RON95 targeting due later. And what lessons from SARA's 100 ringgit MyKad rollout could be perhaps baked into fuel subsidies before the time actually comes?
Thank you, Tehmina. So if you think about it, the SARA rollout is already showing us a lot of valuable lessons. Even though well-intentioned, there's always areas for improvement, right?
Sure.
So the most important is that single-channel systems are quite fragile and they don't necessarily work. So when demand surged on day one for the SARA program, terminals struggled and the trust was affected. So these are exactly the kinds of frustrations we want to move away from at petrol stations when the RON95 subsidies do come in at the end of the month. So where volumes are going to be far higher, people coming to petrol stations, and also where emotions might run a little bit hotter, right? So some lessons that can be directly applied to the RON95 rollout from the SARA program is, let me take you in phases. So before the rollout, like the SARA program, one thing that we can gain from that is that we should ensure that MyKad holders can check their, if they are using the MyKad to check for eligibility, we should make sure that people can check their eligibility in advance, like how they did for the SARA program on the MyKad app or another official channel. Another thing is to publish clear eligibility criteria and maybe also a fact sheet well before the launch date. So answering questions like who is eligible, how do these quotas work, what if the pump time's out, how do I redeem this? So these kind of questions that people will be asking before the day one, there should be a fact sheet that people can
preempt it in a sense.
So kind of make sure we answer these questions before people even have them. This will show preparedness on the government's end as well, which increases public trust, right? So clear messaging prevents resentment and also confusion. And finally, we could also conduct load tests and simulations for the first day surges, so weaknesses can be addressed ahead of time so that we can identify the gaps and give solutions based on whatever gaps there are. And then let me take you during the rollout. So during the rollout, we can consider a staggered launch, similarly to a thing that we could have done for the SARA program, right? Making sure we staggered the launch in terms of region or even ID number to reduce pressure on the system, like we did see for the SARA program.
It's interesting because if you want to be staggering it according to IC numbers, you could very easily ensure that those who are elderly, for example, would be the ones to be able to get first in line. Right?
Yes, correct. Yeah. So, and then actually one of the most important thing that I think is important is to train frontline petrol staff, which they could have done for the SARA program, to train cash registers, mighty employees, all these essential workers, so that they know how to respond when people encounter problems. And I think when they see the preparedness that these staff members have, they will naturally have the trust in the government and trust in the system. So the way frontline workers handle these issues can make the difference between public frustration and confidence. And then finally, after the rollout, we can provide clear entitlements at the nozzle. So for example, showing how many liters or how many ringgit is left in your benefits, maybe set in the receipt that you get at the nozzle, or even an SMS that can be sent to
an automated system.
Yeah, so that kind of shows them how much they have left, and also it encourages transparency and trust and helps people self-manage and self-ration. So the principle is that engineer trust by design. So with strong systems, transparent communication, and also prepared frontline support, Malaysia can avoid the frustration seen during SARA's first days and instead demonstrate competence and care.
Exactly. So there's much to be learnt about it, but at the same time, I think what's really important is having it inbuilt into the system to have offline backup, because potentially speaking, it's going to be a very different scenario unfolding at petrol pumps versus at supermarket or store checkout registers. Derek, let's go deeper from cash to outcomes. Let's say if a rollout such as SARA, either 100 ringgit or otherwise, becomes a quarterly disbursement. So what real difference could it actually make over time and actually even very quickly in the short term to child nutrition or stunting rates? Because this is, of course, an issue that you have long worked on.
Yeah, thank you for that, Tehmina. I think the value of SARA isn't exactly its function as a welfare aid. Again, RM100 is a small amount, and now it's a one-off. The value is it's an experiment for how we can launch these kind of welfare aid programs in the future. And of course, one of it, like I mentioned, is pushing for a universal child grant, right? It's giving us a lot of valuable lessons in how we can roll out the mechanisms, and especially looking at program delivery and design. And my opinion is that the current system is actually too complicated. You know, if we want to really impact outcomes such as child nutrition, child stunting, of which in Malaysia we have 1 in 5 children under the age 2 who are stunted, a number that is higher than some African countries even, right? We need to move from one-off aid that targets just the poor to something more universal, as I've been mentioning. So to just move to quarterly wouldn't really move the needle. And because, for instance, child stunting happens in the first 1,000 days. That is the most critical, crucial window of a child's life. But instead of making, SARA a quarterly thing, we can actually use SARA's mechanism of universal payments and use it to implement a universal child grant but we need to increase the frequency, right? So what we are doing with SARA isn't actually about the 100 ringgit itself, but it's about mainstreaming the idea that we should give universally. And for me, that can start with giving to children. Give it to children who are 0 to 2 years of age, which is the most sensitive time in a child's period of growth. Give it monthly, give it 100 ringgit, or I would say higher, but otherwise give it monthly without restrictions, and you can give it to mothers, right? And what you can do then is you can really see effects that really impact the growth of a child, but also the productivity of a nation in the future.
Exactly, and it's all about measurable outcomes as well. So perhaps mechanisms that may encourage more consistent universal rollout and allocations for children, Derek. What might you recommend? Perhaps maybe a pilot study that tracks maybe dietary diversity and actually shows us, perhaps month on month and quarter on quarter, how this target group of children are actually faring better.
I think in the ideal, right, systems like that are great, but like I said, they're really complicated, complex, and highly expensive. Instead, I think we need to trust parents to make the right decisions. And data from all over the world where there have been universal child grants show that when given an amount of money, even when there are no conditions attached to it, that you have to spend it a certain way, parents actually spend it on their children. Right? And what we're doing here for a welfare system, like I mentioned, is to meet the people at their place of need. And raising a child has many different pain points. It's not just nutrition, right? Sometimes it's education. Sometimes it's having toys in the house. And there's been studies that looked at how stunting rates will actually improve if there's simply the fact that toys exist in the house. Whereas if you talk to someone else, they may say that you can't use SARA to buy toys because that's not essential.
Very true. It's actually about looking at development as a holistic arc rather than just looking at it, all right, food on the table, but is it just rice, bread, etc.? Yeah. Very well said indeed. Vyshnavi, let's dig deeper into looking at privacy as well as, of course, dignity of those involved and whose data has been collated. So how do we target help perhaps more precisely without turning low-income Malaysians into data points who are just tracked across agencies? Because, of course, what Derek has just told us about, that would be the ideal big picture to be moving towards. But let's focus on where we're at right now.
I think this is a very crucial question to ask, right, as Malaysia moves towards a more digital safety net. So SARA has shown how targeted support can be delivered at a large scale, but the challenge is balancing precision with, like you said, dignity, privacy, and trust. So the risk is over centralized databases is that people feel reduced to just mere statistics, and we're much more than that. We're human. So a single outdated entry like maybe a car ownership or even an old address, all of this could wrongly disqualify a household, and these are instances we want to move away from. So communities may also feel like they are under a lot of constant surveillance, reinforcing a stigma that that older recipients and rural families may not have the literacy to access or challenge their records if mistakes occur. So instead, what we can think about, we recommend a less intrusive and more practical approach. So we could collect only the minimum necessary data, so like household income band or even household income size, avoiding overreach. A better thing to do is also to use proxy indicators. So like Derek mentioned earlier, using maybe data like electricity usage or even school aid enrollment and health clinic records, using these kind of data to see which households need this kind of aid without having to cross-check every single data point or across every single ministry. And also empowering community-level validation, right? Talking to village heads, penghulus, resident committees, all of this to confirm eligibility, building transparency, and also shared ownership among government and the public. At the end of the day, I think when you increase public-private partnership and also collaboration, this will only build trust among government and the people, and that is what we want at the end of the day. So also designing systems where eligibility data expires automatically and there is a need to re-verify annually. So this ensures that we reduce the sense of long-term surveillance for people. And at the same time, we should also recognize that cash aid is never really a bad thing. It gives households the flexibility and respects their ability to make choices for themselves and for their families, because at the end of the day, like Derek mentioned, families know best about their own financial situations and their own bills. So with the budget coming up, right, this is also an opportunity to explore expansion of cash-based assistance, either by increasing the amount or even widening the categories to include other essential items like raw food, vegetables, meats, fruits, to ensure aid remains relevant and responsive. The aim is to be precise and fair while making people feel supported but not surveilled.
Understanding that relative perishability of foods also quite often leads into those being the more nutritious ones on the plate, right?
Yeah.
So moving into closing out the discussion though, Derek, let's look at safeguards before scaling. So let's say before this, a similar system or an improved one is used for fuel or even healthcare subsidies, what basic checks and balances need to already be in place for the policymakers to definitely have in mind?
I think instead of checks and balances, I am all for actually simplifying it.
Simplifying.
So currently we have 14 approved categories, like I said. Abolish them, you know, and let people make the decision as to what they want to purchase. If the government is concerned about temptation goods, cigarettes, alcohol, vape, have one single restricted category, and then that's it.
Simplify it, absolutely.
Simplify it.
And yes, be cognizant that that is an area that you want to ensure does not.
And the other recommendation I would make is that instead of the current credit system, we should actually use actual cash transfers. And of course, that can be leveraged using existing e-wallet platforms or just a simple do it now or using digital bank transfers. Let the cash be given out directly so that, and that also avoids system crashes, because when you have cash, it's up to the individual how they want to spend it, where they want to spend it. And here's the thing about cash, it has a really powerful multiplier effect that could really uplift SMEs, you know, small businesses, not just chain business that are providers that are registered under the SARA program. So I think instead of looking at restricting the program even more, we should actually look at loosening it, because that also avoids a lot of the problems that we've been seeing with SARA. One of the things that people point out is that they don't know what items are included in the 14 categories. They go into the shops, they ask the shopkeeper, and sometimes it even has the MyKad or SARA logo, but that's not listed in the barcode. In fact, there is an app that exists for you to scan the barcode to see whether that item is included or not. Why all these hurdles, right? Simplify it, make it easy, empower the rakyat to make the decisions that are best for them. And in fact, when you decentralize this decision making, it actually costs less than building this kind of expensive system.
Because centralization clearly has deep fragilities that have already been exposed. So let's widen that net and also the coverage. Vyshnavi, stopping out from StopGap to safety net. So if the SARA is to outlive its 100 ringgit headline, what roadmap, in brief, would you propose to make it lasting as a safety net and one which we can build on?
Yeah, so SARA has already shown its potential by expanding beyond a one-off 100 ringgit gesture to a target monthly assistance up to 2,100 ringgit annually for poor and hardcore poor households by broadening access to Sabah and Sarawak. So the next step is ensuring that this evolves into a permanent trusted safety net. So in terms of like in immediate terms, in terms of stabilization and restoring trust in the system, we should guarantee that reliability by fixing transaction glitches and preventing these long queues either in petrol fuel pumps or even in grocery stores, ensuring that the ease of accessibility is there. And also publishing real-time dashboards, so like I mentioned, showing uptake, success rates, and also incident resolutions to gain back public trust in the system. And adjusting the benefits to reflect inflation baskets of food and fuel so that the value of the cash rate is not eroded. And providing easy appeal channels for households to update their eligibility or even correct the eligibility if they are not eligible but feel as if they need to. And then in the medium term, broadening and deepening support, we can diversify the benefits into food vouchers, school supply credits, utility rebates, and not just cash. So like what Derek mentioned, instead of putting more restrictions, let's widen it. Let's make it more inclusive to all these other areas where people have a lot more financial needs above just groceries and fuels, because that's not just what we need in our lives, right?
That's right.
Then linking SARA to skills training, micro enterprise support, childcare subsidies, so it becomes a bridge and not just a transfer.
And perhaps even areas for exploring microfinance in the future. Derek, Vyshnavi, thank you very much for the very rich discussion. Well, if Malaysia gets this right, we won't just be talking about one-off handouts, but about a permanent digital infrastructure that can potentially deliver fuel, healthcare, even nutrition support, a dignified safety net with precision and trust. The question we leave you with, is SARA the first step in a subsidy revolution, or will it be remembered as a one-hit wonder? That's all we have time for today. See you again next week with more economic analysis and insights. I'm Tehmina Kaoosji signing off for now. Here's to a productive week ahead. All right, so we're just in the background.